Hello, this is John with Lab4Lab.com. This video will cover a test increasingly requested by physicians, heavy metal toxicity testing. Symptoms of chronic exposure to heavy metals are similar to symptoms of other health conditions and often develop slowly over months or years. Signs and symptoms may mimic multiple unrelated medical conditions. Physicians will consider heavy metal toxicity when signs and symptoms are obscured or inconclusive. Sometimes the symptoms of chronic exposure will abate from time to time, leading the patient to postpone seeking treatment, thinking the symptoms are related to something else. Heavy metals become toxic when they are not metabolized by the body and accumulate in the soft tissues. They enter the body through food, water, air, or through the skin. There are 23 heavy metals, and toxicity can result from any of them. The most common and most hazardous are arsenic, lead, mercury, cadmium, iron, and aluminum. One example of a common toxic heavy metal that most people are familiar with is mercury. Patients may absorb mercury through certain types of seafood, as well as certain types of paints and wood preservatives, among other sources. Chronic exposure to mercury may result in permanent damage to the central nervous system and kidneys. It can also cross the placenta from a mother to fetus, potentially resulting in mental retardation, blindness, and other certain types of brain damage. While aluminum is technically a non-heavy metal, it can also have damaging effects. Patients may ingest aluminum through certain drugstore items like antacids, aspirin, antiperspirants, or nasal sprays. Environmental exposure from drinking water or car exhaust may also be contributing factors, as well as cooking with aluminum products or using aluminum foil. Some evidence has linked aluminum toxicity to Alzheimer's and may be also linked to degenerative muscular conditions. Target areas for aluminum are the central nervous system, the kidneys, and the digestive system. Testing for heavy metals is done through a urine sample. If you are running a toxicology screen, you may use the residual urine to perform the test. The urine is suitable under the following conditions. If stored at room temperature, it is good for 2 days. If refrigerated, 5 days. And if frozen, it is good for up to 2 weeks. Test results will be available 2 to 3 days after receipt of the specimen. You'll receive an easy-to-read report that looks like this. The report will be emailed to you and will also be accessible through a portal. As always, if you are interested in adding this test to your laboratory, or if you want to see the correlating CPT codes and average reimbursements, you can register at our website, Lab4Lab.com, or give us a call at 855-LAB4Lab. Thank you very much for your time.